This morning, October is Breast Cancer Awareness Month, and despite the incredible advances we've made on the disease in the last 2 decades, there's still a lot of confusion about screening guidelines and who's really at risk. Our senior health correspondent, Monica Robbins, sat down with an expert who breaks down some breast cancer myths.
What are still the biggest misconceptions about breast cancer?
Such a good topic. Biggest thing that I hear in our office is I don't have a family history of breast cancer. Nobody in my family has ever even had a breast problem. Why do I have breast cancer? And we know that the vast majority of patients with breast cancer, this is a spontaneous event, meaning you do not need to have a family history. You do not need to have a genetic risk factor, right? Like a BRCA1 or BRCA2 mutation, a PALB2 mutation, something that we would need testing for or that would like run in our family. Majority of breast cancer cases are sporadic. They don't come from anywhere in particular, right? There's lots of research going on into why do we still get breast cancer and could there be a vaccine for breast cancer and things of that nature. But everybody needs to get screened for breast cancer, whether you have a family history or not. If you're a woman and you're age 40 or older, please, please, please get your mammogram once a year. And if you do have a family history of breast cancer or you have other risk factors for breast cancer, like dense breast tissue, or you've had atypia, a biopsy showing atypia, a surgery showing something of that type, please get in touch with a breast-specific provider. Your primary care doctor can help refer you so that we can help guide your care.
There's still a lot of mixed messaging coming out about when women need mammograms. Can you clarify it from your perspective? Because you're the one who sees breast cancer on a daily basis.
Yeah, a great question. I do think there's confusion still around that because there have been different guidelines over the past 10-ish years. You know, some groups have had different ages at which we start and different frequencies at which we should get them. But the standard from the American Society of Breast Surgeons, which is, our national group, we take care of most breast cancer patients in our country, and backed by the American Cancer Society, is a mammogram starting at age 40 and annually thereafter until your life expectancy is such that it doesn't make sense to get mammograms anymore, right? So there's not like an age, right? It's not like 75, it's not 80. It's when your life expectancy is probably less than 10 years, or if you had a breast cancer diagnosis, you might choose not to treat it.
Talk to me about what's different in breast cancer care these days.
So many of us, have a lot of fear around breast cancer and what is that going to mean for me? Am I going to die from breast cancer? Right. And I would say majority of the time nowadays, we have a very early stage of diagnosis. If we are getting our mammograms, as we just talked about, early and regularly, most breast cancers are found at an early stage, meaning we find them on a mammogram or an MRI, some type of a screening test. The minority of breast cancers are found through an exam, right? Either your own self-exam, which I should mention, those are also incredibly important. Women should be doing a monthly self-breast exam. Usually recommend just doing it at the same time of the month, right? Some people will say I do it when my period starts. Some people will say I do it on the first day of every month. It doesn't matter as long as you do it once a month. And then you should be having an annual exam either by your primary care provider, your OBGYN, or one of us in the breast specialty. All of that to say that because we have good screening, most breast cancers are diagnosed very early, and that means they're all treatable. All breast cancers are treatable, and most breast cancers are curable, meaning that this is going to be a contained diagnosis, right? This is not going to be something majority of the time that threatens your life. We have such good treatments nowadays. I mean, almost every breast cancer now still requires surgery, but many fewer require chemotherapy. And I know that's a big fear out there, right? Am I going to have chemo? Am I going to lose my hair? Am I going to get really sick? Am I going to be able to take care of my kids? Am I going to be here for my kids? All of those things are incredibly important concerns. And I can tell you that we do give chemotherapy when it is needed, but to so many fewer women than needed it in the olden days, right? In the olden days, we're only like 10, 15 years ago. And same thing with radiation. Many breast cancers do require radiation, but some of them don't. And women have lots of choices about which type of surgery they can have, as long as we have early stage disease, right? The higher the stage, And there's certain what we call receptor subphenotypes of breast cancer that do require chemotherapy and more immunotherapy, more sort of targeted therapy. But all of that being said, we have such great advances in the field that we don't need to be scared of breast cancer. We just need to get it treated.